Hello, and welcome to the Washington State Board of Nursing's BONcast. I'm Karl Hoehn, and I'd like to welcome you. I hope you enjoyed learning about our state's Board of Nursing, officially called the Nursing Care Quality Assurance Commission, and specifically about the work we do to ensure the safety and well-being of the people of Washington State. For our third episode, I'd like to introduce our two guests. Kristin Waite-Labott has been a registered nurse since 1991. After losing much to alcohol and drug addiction, she turned her life around and now works as Director of Client Care at Veritas Treatment Center. She's published a book about her story of recovery called An Unlikely Addict. She writes a blog on issues surrounding addiction and works with others who struggle with addiction as a recovery coach. Her goal is to increase awareness about the problem of substance use disorder in healthcare. Dr. John Furman is a registered nurse. He has worked for the state of Washington for over 40 years, primarily in the areas of behavioral and occupational health. Dr. Furman has been influential in the promotion of healthcare safety for many years, with involvement in the creation of Washington state regulations, including but not limited to bloodborne pathogens, workplace violence, and hazardous drugs. He currently sits on the board of the National Organization of Alternative Programs and chairs its research committee. And here's Dr. Furman.
Thanks for having me, Karl. Limited data exists on the number of nurses who misuse alcohol and other drugs, and that includes prescription medications. I think best current estimate is that misuse mirrors that of the general population, about 12 to 15%, and I don't think that should be a surprise to anyone. What's especially troubling is that the American Nurses Association estimates that 6 to 8% of these nurses misuse to the extent that practice may be impaired. And then in addition to patient safety issues, there are also personal consequences to consider. And these may include loss of health, family, license, or even life. Healthcare professionals are highly trained, they're respected, self-motivated, and are often expected to assume leadership roles. It's very difficult for them to reach out for help, especially when they fear losing their career. So when thinking about nurses with substance use disorder, realize that substance use disorder in nurses is increasingly being recognized as an occupationally acquired illness. Substance misuse is a form of self-medication. It's a way to manage the many stresses in healthcare work. These include exposure to trauma, lateral violence, physical demands of the job, and shift work and long work hours, up to 12-hour shifts. Stigma, shame, and fear of losing one's license and livelihood are significant barriers to seeking help. However, the most important thing to realize is that treatment works. Nurses and other healthcare professionals who receive treatment and are engaged in long-term monitoring are not impaired and are able to practice safely and competently. Nurses and other healthcare professionals are valuable public assets. We don't want to lose them based on a manageable disease, akin to other chronic relapsing diseases such as diabetes, asthma, hypertension. In fact, these diseases have higher relapse rates than substance use disorder. I like to refer to Dr. P. Bradley Hall, the Executive Director of West Virginia's Medical Professionals Health Program. He states, and I quote, "Health professionals have a right and an obligation to ask for help when they are struggling with impairment. When they request assistance, they deserve the same care and respect that they give their own patients and clients every day." I'm now honored to introduce Kristin Waite-Labott, RN. Kristin will share her very personal and life-affirming journey through addiction and recovery. Hi, Kristin.
Hi, John. Thank you for the introduction, and thank you for having me here today to share my story. I'd like to start with talking a little bit more about those statistics that you referred to earlier. In particular, the two that say up to 15% of nurses struggle with some form of substance use disorder, and that up to 8% of them are using substances at a rate to impair their practice. Statistics are one thing, but I like to put a number on that because it's a little bit more impactful. In the United States, we have over 4 million nurses, which means if you look at the 15% statistic of those struggling, that means there are about 600,000 nurses in this country that are struggling with some form of substance use disorder. And if we use the 8%, that means there are about 320,000 nurses working impaired. Those are the nurses that we really need to reach and let them know that help is out there. My story really begins in college. I went away to school, had a lot of anxiety, very excited, but also a lot of anxiety about what was to come next. I had no idea what to expect and was a little fearful. I found then that alcohol helped to alleviate a lot of that anxiety. And so I drank plenty and often, enough so that it took me 6 years to get my 4-year degree. I did get my degree, graduated a BSN, and moved back home. I live in Milwaukee, Wisconsin, and started practicing at a hospital in Waukesha, Wisconsin. Things went really pretty well for a while. I drank off and on, but usually at home alone, which I told myself was great. I wasn't going out to bars and drinking. I was drinking, at home all by myself, which of course occurs to me now that that was not normal. But it was in 1997 that I had a minor surgical procedure and I was prescribed Percocet. I found that I loved that Percocet. It did the same thing for me that the alcohol did, relieving my anxiety and at that time depression as well. But I didn't act goofy. I didn't slur my words and stumble around and do silly things. I found that I could hide my using it easier than I could with alcohol. So over the next couple of years, I found myself trying to find reasons to ask for more pills. So I exaggerated back pain and my doctor would give me pills. My then husband was a carpenter and hurt himself periodically. He would share his pills if he had any with me, and I would sneak them as well. I even called in a refill on a medication he had once that he knew nothing about, and then I took all those pills. So I did those kind of things over those next couple of years. And then around the year 2000, I was working in an emergency room, and it occurred to me that we throw away a lot of good drugs. And I started taking the wasted medication. And from that point on, anytime I had wasted medication, I would take it. I would have my peers sign off on it for me, which they always did without question. And I would take and use whatever was left over, usually IV drug. And that went on for a few years. In 2003, I was going through a divorce and was really overwhelmed. Both anxiety and depression was really overwhelming for me. At that point, I was introduced to fentanyl. I had wasted leftover fentanyl from a patient. And I found when I took that fentanyl that I immediately craved more. All the other drugs that I took, it didn't really matter what it was. I preferred opioids. But if I didn't get anything in a shift, I would just go home. I didn't like it and I was, not happy, but I went home. After using that fentanyl, I found that if I didn't get anything wasted that shift, I began taking it from stock. And so it got to the point where every shift I was taking fentanyl from stock because that's all I wanted. I didn't want any of the other medications anymore. So it was at that point that they discovered what I was doing. I think it took them about 9 months, but I was fired once they caught me diverting. I was fired, lost my nursing license, and I ended up spending about 4 months incarcerated after a relapse and calling in prescriptions for myself. So it was at that point in jail that I decided I was done. I did not want any part of this life anymore. I did not like jail, and I did not like being away from my kids. I just was done. I decided on my release from jail to do whatever it was that I needed to do to be sober. And so that's what I've done really for the last 17 years, just rebuilding my life, my career, all of that. In 2007, so about 2 years after getting out of jail, I decided to petition the Board of Nursing here in Wisconsin about reinstatement of my nursing license. much to my surprise, they did reinstate a restricted nursing license. I was actually shocked because I did not think that was possible. I thought my license was gone forever. So I was absolutely thrilled that they allowed that. And I joined the monitoring program through the Board of Nursing here in Wisconsin. It's a 5-year monitoring program for nurses with issues such as mine, and allows a nurse to practice and be monitored with urine drug screens and reports and therapy and the like, to make sure that the nurse has the resources and what they need to return to safe practice. So I completed that program, and I have my full licensure back now. I'm grateful to be able to work in an emergency department again. And then I also work with nurses, and probably the most meaningful part of my recovery has been my work with Veritas. It's a virtual intensive outpatient program, and through them I get to do nurse coaching, nurse recovery coaching. So for nurses in that program that are just beginning their recovery journey, they're at that point I was where I lost my license and had no idea where I was going to turn. I get to use my experiences now to benefit those nurses and share what happened to me and let them know that there's hope that they can get better. It's not the end of the road. In fact, for me, it was really the beginning of a whole new, way of life, a much better, much more meaningful way of life. And I'm so grateful for every step of the way and everything that I went through, because it got me to where I am today, which is much better than where I started, even before using substances at such an alarming rate. Life is pretty good now. So just in closing, I would say it's really important that we share our stories, those of us who have been through the process, so that people know, number one, that it's a problem, but more importantly, where to go when they're ready to get help, where to direct somebody if they discover someone who has a problem, and to know that recovery is possible. It's possible to return to safe nursing practice once you have the tools and resources that you need. So thank you. Thanks, John.
Kristin, thank you very much for sharing. I do have a couple questions. It struck me that it took so long to discover that you had been diverting medications, that no one spoke up sooner, even though there were warning signs.
Yeah, I think the problem was that folks didn't know that the warning signs were actually signs of substance use. They explained them away with various excuses. For instance, I was shaky, especially towards the end of my using. And they would, first of all, I have benign essential tremors, so I do shake a little bit. However, it was so bad. And we explained it away by, I worked night shift and had a lot of coffee. I was tired, going through a lot of stress, all that kind of stuff would make me shakier. Other signs were I was falling asleep in between, work. I would sit down and fall asleep. Obviously, that's, a well-known sign of opioid use. However, I worked night shift, and the thought was, she's tired. I work 3 night shifts in a row. I'm tired. I fall asleep. And then my personality was changing. I was becoming more irritable and like snippy, and which is not like me at all. And people attributed that to my going through my divorce and explained it away that way. So there were other signs too, but another one that I think is important to note is that I was taking more breaks. I would find reasons to go to the bathroom more often. I smoked cigarettes, so I would say I'm going out to smoke another cigarette. And those breaks or those visits got closer and closer together, towards the end of my using. So things like that they just didn't know. I was displaying the signs, they just didn't know what they were. So training is really important to let people know what to look for.
So if there's one thing that you would want nurses who are struggling to know, what is it?
That help is out there. There is a lot of help for nurses with substance use disorder, but it's not well known. So they have to reach out for that help. And, it's not going to fall into their lap. They have to seek it. And it's so important, again, for us to share our stories so that people know where to go for help. Like I had no idea that there was a monitoring program through the Board of Nursing that I could talk to about my problem, and at least they would guide me in where to get help and monitor me so I could keep my license before my whole world fell apart. I could have done that. But there are monitoring programs or alternative to discipline programs in most states now. So that help is out there. Nurses just need to know where to look for it and to be brave enough to push past that stigma and ask for it.
Kristin, thank you again.
You're welcome.
In Washington State, Washington Health Professional Services, or WHPS, is the Nursing Care Quality Assurance Commission's approved alternative to discipline substance use monitoring program. WHPS serves all nursing professions, nursing technicians, licensed practical nurses, registered nurses, and advanced practice nurses. At any given time, there are approximately 300 nurses participating in WHPS, maintaining their health, saving their license and career, and providing safe patient care. WHPS is a confidential monitoring program. It does not provide clinical treatment. The program provides swift, compassionate intervention, referral for evaluation and treatment, and ongoing monitoring services such as random drug testing and peer support. Nurses are provided the opportunity to document their recovery and ability to practice in a safe and competent manner. WHPS views employment as a nurse as an important part of recovery. At any given time, upwards of 80% of nurses are fully employed as practicing nurses. The Nursing Commission recently released a position statement on substance use disorder in the nursing profession, which can be found on the WHPS website. It highlights the WHPS voluntary participation track. This track allows nurses and healthcare employers to report concerns regarding substance misuse directly to WHPS and not file a complaint with the Commission. The advantages of voluntary participation are that nurses can get immediate attention and referral to treatment. Nurses are not subject to disciplinary action, and their participation is not made known to the Commission as long as they are fully engaged in monitoring. Also, some listeners may be residing in other states. Be aware that most states have alternative to discipline programs like WHPS. Thank you for your time and attention, and a special thanks to Kristin Waite-Labott for sharing her story of recovery.
Thanks, Dr. Furman. On behalf of Washington State's Board of Nursing, thank you for listening to our BONcast. Be on the lookout for future episodes.